HealthTech has had a significant impact. Specifically in oncology, they've revolutionized how we diagnose, treat, and manage cancer, primarily in like early detection and diagnosis, MRI, for instance. So it's just incredible to see the tech advancing in the healthcare space. At the core of everything we do in the healthcare space is the patient. And if that patient isn't benefiting or realizing the value, then what's the point?
Hi, everyone. Welcome back to the Beyond Product podcast, the podcast that we are exploring products and the value that they are creating in people's life. My name is Moshe Mikanovsky. I have with me today Sri and a special guest. So first of all, Sri, hi.
Hey guys, thank you so much for tuning in today. My name is Sri. I'm the co-host for Beyond Product podcast. I'm more interested in the human approach to product innovation and the beyond product value creation. How does it affect human value? Like, how does it make the human life better or worse? So I'm more interested in the human approach to it. Today we have a very special guest, my friend Tim Masters. Is the Director of Product Management and Design for Inspirata. Inspirata is a suite of products that helps in various different fields in oncology. We're going to talk more about these products. But first, let's talk more about our guest. In his own words, he is a fierce patient advocate and healthcare informatics professional. He has more than 20 years of experience in clinical radiology, cardiology, oncology, and hospital and IT. Two different fields, isn't it? And he's also an avid volunteer in the community. He volunteers for ABII, the American Board of Imaging Informatics, ISRT, Idaho Society of Radiology and Technologists. And he is also a volunteer in St. Alfonso's Project Haiti.
Yes.
He's a fantastic person, all in all. And he is also a veteran who served in U.S. Army for more than 8 years. Wow, that's an amazing feat. First of all, Tim, IT is all about zeros and ones, and then we have healthcare, which is more about patient experience and having human-centered approach to it. And you're in the middle of both, Tim. Yeah, it's you're stuck between the numbers and the people. So, and in your own words, you're a fierce patient advocate. First of all, that's how you start
Absolutely
introducing yourself. So, where do you want us to start?
Well, thanks, Sri. I'd just like to take the opportunity to thank you for inviting me to participate in the podcast. Again, I was humbled when you asked me, and happy to do so. It's a great point that there's a kind of a pivot or a shared space between IT and healthcare. IT is pivotal in the healthcare space today. We couldn't do our jobs in the hospitals without the help of IT. And technology ever advancing. I think healthcare over the course of my career, 25 plus years, we've always been slow adopters, right? We like our paperwork. We like to shuffle the papers, but it's not always conducive to patient care. So I think what my clinical background brings to the IT space is a bit of that empathy. I know how the users behave. I know how difficult their day-to-day jobs are. And if I can help position a product in the IT space that will make that part of their day easier, that's what I live for. That's my passion.
That's amazing.
Love it, all of it. It's really interesting the way we are in Beyond Product podcast and you're starting from people. Moshe, how do you want to take this further? How do you want to bring it back to product?
Yes, of course. So we have a lot to explore today. As Sri introduced you, he mentioned you were working for Inspirata, and we want to explore that, your recent experience over there. Who is Inspirata and what do they do? What products do they have?
Well, Inspirata, we're a healthcare technology company, and we focus primarily in the cancer informatics oncology space. Our mission is to deliver inspired data, Inspirata, and insights. The light bulb went off, right? Inspired data.
Yeah, I've been working with it for a while now, but I didn't even know this. Okay.
Yeah. So what we really want to do is bring, those insights that make every moment matter in a cancer patient's journey. Cancer is a devastating disease. We all know that. I've been personally impacted. My father passed away from lung cancer, so I've got a thanks. I've got a personal context here, and I think anything I can do, even the smallest little step, with our products at Inspirata to help a cancer patient have one more minute of meaningful life, that's very personal for me. We have to really build that trust for our clinicians, right? So they can trust our products to bring the appropriate information about their patients to the table, so they can make their clinical decisions. So that's what the mission at Inspirata is all about. Our technology, we've been around for about 20 years. We've been, for the past 2 decades, building out, believe it or not, AI has been around that long in some form or another, right? So for the last 2 decades, we've been working closely with the National Cancer Institute, the NCI here in the US, and we have our products in hundreds of healthcare institutes across the nation. Actually, globally, we're in cancer registries in Australia, New Zealand, but we're primarily focused here in the US and Canada. We have a proprietary NOP engine that's at the heart of my products, a Trial Navigator suite of oncology solutions, and in our ePath Plus product, which is a cancer registry application to help abstract information from the patient's medical record for tumor reporting. Yeah.
This is absolutely inspiring, a very apt name. It's also inspiring because, like you said, I think that there isn't a person on earth that was not touched somehow by cancer, whether
Totally
it's
true.
a family member or a friend or themselves. I have family members that have been affected by it. Some passed away, some, survived. So it's definitely a very impactful place. When we talked before the recording, you mentioned to me that your background started also in health. So you were always been in health in different areas, and then eventually you became a product person, which to me is like, wow, that's amazing.
Yeah.
Because I'm always also curious about how people get into product management, because product management is what I'm passionate about, but it's also where you can find that value that users needs and etc. So what was your journey there?
Interesting. So before joining Inspirata, I worked for GE Healthcare for 12 years, and a longtime customer of GE in the healthcare space, working off their CT scanners, their modalities for advanced imaging. And when we introduced PACS, Picture Archiving and Communication System in the hospitals in the early 2000s, it really significantly changed the workflow for technologists and radiologists in general. And I've always been IT, savvy, interested, and that's what really drove me to get my IT degree after being medically trained, because I saw such an opportunity. It's a niche space there where if you have somebody that knows the workflows, that has lived through the pain of an implementation of a new system like a PACS, and know how the users interact with it, and ultimately how the patients are impacted by it, I think that brings something special to the table, right? There, in the PACS space, there's always this argument about who is the best PACS administrator. Is it a clinical person or is it an IT person? I lean toward the clinical side, obviously, because that's my background. But as long as there's a balance between those two spaces, I think it works well. Now, when I worked for GE, I started off in a sales kind of workflow consulting position because I've used the product for a number of years. I knew the workflows, and I think that's something that at the vendor level is sometimes overlooked. They design a product the way that they think it should be done. Yeah, they're probably driving off of some user feedback. But after a couple of years in that sales support role, I was thinking, what a difference I could make if I actually had my fingers in the product, right? I knew the pain points. I knew you know, kind of the skeletons in the closet, so to speak, about the application. So I thought I'm going to pursue or look for an opportunity to hop into product management. And within, 24 months of being at GE, that opportunity arose.
Amazing.
So came right in, started making changes and improvements. And, I had all of the networking with all the users already.
You're a people person. That's one thing that is important. And for the viewers who are listening, can you tell us, Tim, what PACS is? PACS? Because I'm a dumbo on this lingo, so I just want to understand that.
It's the acronyms, right? In military background. Picture. PACS is Picture Archiving and Communication System. And this is basically the application that a radiologist uses to interpret the digital x-rays. So all of the images from diagnostic x-ray, CAT scan, MRI, nuke med, ultrasound, they all come into this massive database, and the radiologist uses these applications to step through their workflow, interpreting and oftentimes reporting on those exams.
Just piggybacking on that, you are a registered radiologic technologist. So I just want to understand the credential a little bit, because it has also give us a peek into the intersection between technology and the radiology. So please go ahead.
And this is, you go through your training, typically a 2 to 4 year program in radiology, and then you take this test, a credential test, to gain that RTR, Registered Technologist credential. And we have to maintain certain levels of continuing education every year, and we have to renew that credential into perpetuity, meeting the guidelines and keeping up with the new standards and technology in the space.
Interesting.
I also carry the CIIP credential, which is the Certified Imaging Informatics Professional credential that is given through the American Board of Imaging Informatics. I just recently rotated off the board for Abby this past year. Incredible experience, 5-year term as you go through the different offices, secretary, treasurer, chairman, etc. And that credential, again, is guided by a certification test that it's kind of a combination of the clinical space and the IT space, specifically for imaging informatics. So I always put a plug out there for the CIMP exam wherever I go and talk to different groups, because it's really important to make sure that you have those type of trained professionals in your space to manage those technology solutions that so tightly integrate into the clinical workflows. So,
absolutely. Yeah, absolutely. Yeah. But one thing that I really like that you mentioned is that, you mentioned how you had the empathy in your work when you started at G, and you knew the users, and like Sri mentioned, you work with people, you understand them, you understand their needs. And also from that experience and background as a technician, you had that technical experience. This is really one of those things that are very important for successful product people to build the right product, because they have that empathy to the users. And sometimes we forget about those things, and some people come into this industry without that empathy. So that's actually is a very important part of that. The second part of product management that lead us into our next path in our podcast today is about the value, because that's what we're trying to create as product people. We're trying to create a value to the users and the clients, and a value to the organization that build the product. So tell us, first of all, how do you define value, and what does the value in a product means to you?
Well, value is subjective, I think. As product manager, I want to make sure that I'm bringing value to my customers and ultimately impacting how they care for their patients. At its definition, value is the worth or importance of an object, right? How do you perceive that? What benefit does it bring to you?
The clinical definition, right?
Right, exactly, and it's different from those two different lenses, clinical versus IT. So I think when it comes to value in the product, you're really referring to the perceived benefits or advantages that product brings to your customers or end users. It's how the product meets the needs and the desires of your target audience, your users, and what solution does it provide for them to improve their day-to-day workflow challenges. I think ultimately that's the value of a product, right? What does my product bring to the table that makes my end users and their patients' lives easier at the end of the day?
Yeah.
Now,
Yeah.
from a business context, creating that value, I think it's vital for product success on the market, right? It has to bring value, or it doesn't go anywhere. No one will buy it if it doesn't bring value. So you have to look at a number of aspects to that, right? Is it functional? Does it perform its intended task? Does it work with quality? Is it superior amongst its peers or its competition? Does it bring the features that the users want? Is it enhancing the product's ability to improve their workflow? Is it priced accordingly? So it's not just a product perspective, but marketing and positioning is all part of that as well, right? Do you have the right level of customer support?
Yeah, when you explain that, I almost kind of see a Venn diagram of different values intersecting, and in the center is the optimal value creation for a product. Like you talked about the business angle to it. Is it priced accordingly, or is it doing everything that it's supposed to do in terms of features? Is it taking into account all the user's experience and what they want from the product? So it seems to me that's where you are aiming to say the value of a product.
Yes, and you have to understand the personas at the customer side as well. So as you're at the table talking to a clinical user versus an IT support or management person versus the CIO or CFO who may be writing the check, each one of those personas have a different perception of value that the product will bring to them. And that's really at the core of product management, if you think about it, that these are all aspects of the product. When we come up with the idea, we have to consider all of those different components. And then what is that, I don't want to sound too salesy here, but what is that pitch to that personas? And when they're all sitting at the table, that can be sometimes difficult to juggle, in a conversation across the board, right? That you have an encompassed audience there, and how do you relay the value from a pricing perspective to that clinical end user who just worries about how many clicks they're making in an application at the end of the day, right?
It begs to take into this direction of what then when you say value for different people is different thing, and across the board in healthcare specifically, we have different spectrum of stakeholders. There are like doctors, clinicians, and there are nurses who work with patients, and then the patients themselves. Each has a different meaning to the value of that product brings to the table. So in your experience, how you have seen this value transpire between the stakeholders, one, and secondly, how do you think the product, you talked about products which doesn't have good understanding of what the user want previously, especially with HealthTech. So how you have seen the value evolve over the period of time?
I think, I've seen it across the gamut, having worked in the hospital, both in the clinical space and the IT support space. I was at the table with both of those perceptions, right? Listening to GE in this example pitch to me why their product is the best for our workflow in radiology. I think the other personas rely on each other for feedback. Like to the clinical person, the CFO or the CIO is going to say, is this bringing value and making are you becoming more efficient and providing better patient care? To the IT director, They're going to be asking, how difficult is this going to be to implement and support, and how long will it take to get it into production? And then at the end of the day, the CFO is saying, how much is this going to cost me? And what's my ROI? When will I, recognize that? That you have to think across the spectrum, right? And I think primarily, if that product isn't successful in doing what it needs to do, bringing the value to the patient,
Yes.
At the core of everything we do in the healthcare space is the patient. And if that patient isn't benefiting or realizing the value, then what's the point, right? The product will fail.
I definitely love it that you bring it back to that. Because you touched on something very important in B2B, where in B2B products, you will have the people that make the decision to buy it, and then you will have the people that will actually use the product. So whether it is an MRI machine or whether it is an ERP system for an enterprise, it's the same thing. The person that will pay the bills and will sign the check will probably not use those products. So you have to kind of convince both of them, like you said before, but at the end of the day, the value there is not just what is my ROI or what is my bottom line, and it's also not always how do I make my life easier as one of the people working here, but like you said, in clinical terms or in health industry, the patient. So the patient is the one, and you started it in the beginning when you said, we want to help and every cancer patient live better life, live longer life, etc. So that's really the mission, the vision, and the mission. I assume of the company, and then the products are following that.
Yes,
right?
Absolutely. I mean, that's our core. That's what I live and breathe that mission.
So let's dive into that a bit more. How do you see tech products impacting and creating value in oncology? And you can talk specifically about your products. You mentioned a few of them before. So it's a whole ecosystem, I assume, of products out there. Some are software only, some are both hardware and software. So how do you see that, the value of tech products in oncology?
Well, specifically in oncology, I think tech has had a significant impact, right? They've revolutionized how we diagnose, treat, and manage cancer across the board. In some of the, I think, pivotal ways that we've brought value here is primarily in like early detection and diagnosis. It's a very tight puzzle in how these different areas work together in the healthcare system. So my imaging background is one of the first steps in detecting cancer, right? So the patient has symptoms and the doctor orders an X-ray or a CAT scan or an MRI. And that is typically the very first moment that the patient realizes or the clinician realizes that the patient is being impacted by cancer through those imaging technologies. So think about MRI, for instance. That technology's only been around since the 70s. CAT scan, has only been around a little bit longer than that. I started doing CAT scan in 1990, and it's incredible to see the advances of that first machine that I took images on that took 30 seconds to get one image of the brain. Now does the entire brain in less than that time. So it's just incredible to see the tech advancing in the healthcare space. The other areas I think that we see huge steps forward is in precision medicine, targeting treatments specific to disease in a specific patient. And that was unheard of 5-10 years ago. Improvements in tech and genomics and molecular profiling have, facilitated that growth in that precision medicine space in oncology. And by really being able to go in and analyze the genetic makeup of a tumor, the characteristics, the clinician can tailor the treatment to target those specific abnormalities. this really makes the treatments, the therapies more effective, and they can attack the disease much sooner than they ever have in the past. And probably the most impactful, I think, is how big data has come into the discussion. The data that is collected in the healthcare system is just immense.
Yeah.
And we really need to figure out, and this is one of my pet projects here, what I'm really passionate about is how we can take that enormous data set, all these different points about the patient in the EMR and ancillary systems, bring them together to provide those possibility for the clinicians to make those treatment decisions in a much faster pace than ever before. I think being able to position that data for clinical trials and for registry, those are what my applications do specifically, matching that patient to that trial before they're even meeting the doctor for the first time really speeds that time to treatment, which is precious time, right? That is an element in this whole process of the cancer journey that you cannot diminish. It's so important to get the right treatment to that patient in a timely manner to give them more time with their families or a faster road to being disease-free.
Wow, that's we kind of scuba dived with you there, Tim. I was just tuned entirely into that conversation. I really, really love the way you're taking the value from how it has to translate for different people back to the core of what it translates for the patient, and then defining that value through technology by creating a specific way in which we can diagnose faster and making sure that we diagnose correctly and faster, so we can the patient has more time to get the treatment they need and to spend more time with the family, and how this technology has evolved within imaging specifically from 70s to now and so forth. You also talked about data, for example, that's very, very important aspect. And when there is data, then there is systems that analyzes data. And you have seen, and you've worked in GE for more than 12 years. So can you explain to us as to how the healthcare data and what we make of healthcare data has evolved over the period of time in terms of intelligence, in terms of, how we perceive the data, how we utilize the data, and how we make sure the data is at the center of what we do in terms of response to a patient's disease?
Yeah, I think historically that the most difficult part of managing that data, data's been around forever, right? It's just how we use it, how we manipulate it, how we leverage it to help make those clinical decisions, I think is pivotal. And as a vendor, as a software vendor, I want to bring a solution to the table that makes that aspect of slicing and dicing that data into meaningful outcomes as easy and straightforward as possible. One of the biggest challenges when working in the hospitals, we had all of these IT systems that captured all these data points, but then you had to hire a specific data analyst and a report writer to access it. And honestly, it's great that your system has the data in it, but if you can't get it out of the system in a meaningful manner, in a dashboard or a report or something that can, right, it doesn't matter, right? It's great. Hey, we've got all this data, but you have to be able to deliver it or serve it up to the customer in a meaningful manner that they can use and make that data meaningful for the patient. So that's kind of one of my, again, I mentioned earlier, one of my pet projects that we're building a data analytics application or module as part of our portfolio. And I've been going out talking to customers, trying to understand what reports are they routinely running, what are their operational mechanics in the organization, what are they taking to tumor boards, what are they taking to their different, their rounding with their residents, and how are they communicating disease progression? How are they communicating effectiveness of trials? Things like that. And that's what I'm bringing into a baseline product here at Inspirata with our business intelligence module, and hoping that with a click of a button, they're going to be able to look at a dashboard and look at their operational effectiveness. Are they, how many patients do they have that fit a certain criteria for a specific trial? How are those patients trending in those trials? Like, are they falling out early? Are they finishing the trial? Are they having better outcomes? So as you can imagine, it's really hard to measure that success in many ways, because ultimately success is that it impacts the patient in a positive manner. We don't always have that visibility, even in the downstream systems, the clinical trial management systems, the rad oncology and med and surg oncology management systems. You may get bits and pieces of that data. So it's difficult to measure, and ultimately the value, the measure of success and bringing value to the customer is measured in their feedback. Are they enjoying, maybe a stretch, but do they like working with the product? Is it easy to use? Does it meet their needs? And then the other part of that is listening for that feedback where you can improve the product. What are their problems? You really have to listen carefully when you're talking with a customer, because they're not going to come right out 9 times out of 10 and tell you, I want your product to do this. They're going to say, hey, I'm really having a challenge with, looking at the demographics for this type of patient. I want to target more inclusivity data into my outcomes. How can I get visibility into that subset of patients? Whether it be regional or gender-based, or there's any number of data points that they may be looking for bringing inclusivity into their environment. So again, something I feel strongly about, making sure that the technology is available across diverse groups, that there's equity in the application, and that we're removing biases that may come either naturally through human behavior. There's data that AI is biased too. So I think we really need to be cognizant in that space.
I know I really love the topic you're talking. Moshe, sorry, I have to take a minute and talk about diversity and inclusion, which is one of the biggest driving force for what I do in my professional and personal life. And Tim, I've also seen in June, there was a specific discussion on diversity through product innovation in Inspirata, and you were part of that. So can you explain to me, is that your baby, or how does it all came to be?
Well, it's I think Inspirata has at its core values, we understand the importance of diversity, right? And it's something that I want the products to emulate, in that we're providing that technology across all types of diverse groups. And in doing so, I think we have the opportunity of managing that, since we're so AI based, we have an opportunity to apply additional filtering to make sure that AI isn't biasing my products, that we are able to position the products across regional diverse groups, that we're not driving, working in, one example is like the gender harmonization project that's top of mind in Canada right now. And as we talk about standards in healthcare like HL7 and fire, how do we include those different groups within applications from a standards perspective, to make sure that we're addressing or making the product available across all of the diverse groups. So from an Inspirata perspective, we want to make sure that the products that we put out are cognizant, are sensitive to those needs for all of the diverse groups. And, we get feedback from our customers in that regard too. The cancer centers want to make sure that they're serving those populations appropriately and equally And I think that's hugely important.
That's very powerful, since cancer doesn't discriminate between people.
Exactly.
It exists
Exactly.
in every race, every person, every
Absolutely.
gender. When you see that, and that's your mission to eradicate or to reduce the effect of cancer, then you really have to be diverse and treat everyone equally. You also one of the products that Inspirata has is an NLP product, and I'm really curious about that. You mentioned a lot about AI before, and about big data and how do you get information from the data. What do you do with an NLP?
So interesting, and there's a couple of different use cases we have for that. We call it NLP on demand, NLP, natural language processing. It's kind of all the hype in the media, recently with Chat GBT and some of the other applications that some of the large companies are putting out in their web browsers. Ours has been around for a while. It's not a new kid on the block by any stretch of the imagination. But what it does is it gives us the ability to put the written word into context, right? We can bring unstructured data into a healthcare environment that is very much a structured data element driven workspace. And I think that's one of our challenges that we've had historically to overcome is you have all this paperwork in the healthcare space, and that might be in Excel files or comma separated values. It could be PDFs. How do you get that written or typed document into a structured data element? And that's what NLP on demand basically does. You feed in the file, it analyzes it. We run it through knowledge bases that are very specific to oncology, radiology, and then we can extract those data elements and then map them. Once we get that into structured data elements, we can map those into the standards-based applications using FHIR, we're using HL7, et cetera. And I think that's one of the challenges, especially that healthcare institutions are having today is, and the EHR is a wonderful concept, but they are still struggling on how to share that information across facilities, especially if it's outside of an IDN or a group of hospitals. Like I worked for HCA for 18 years, and we could share patient information between related hospitals. I grew up in the Denver market, and we had 6 hospitals there that we could move records around those hospitals. But if somebody asked us to send it to a Sisters of Charity hospital or a Catholic Health hospital or something, it was basically handing the patient a CD-ROM with all of these files on it and say, good luck, And there's a huge impact there, not only to the patient, but to healthcare systems in general, because a lot of times that patient will present with that CD and the intaking hospital or facility will say, I don't know what to do with this. We're going to order another CAT scan, another MRI, another blood test. And think about the cost impact to the healthcare system in America with that approach. And it's simply to get access to data that already exists.
Yes.
So this is where I think NLP really plays an important role in being able to make that data more portable, shareable, and at the end of the day, putting it into a format that the broad spectrum of IT systems can work with versus a printed PDF form.
And one of the important things to mention about NLP specifically is that there are systems that are doing it generically. But because of the speciality of oncology or any other type of products that or industry that have special wording, special terms, etc., special structures for the data, there is a need for a product like Inspirata's that actually understand that industry in a deep way.
Exactly. And that kind of leads to the 2 different workflows I mentioned earlier. Is one is this portability of information and helping ingest the unstructured data into more of a structured format for healthcare systems to ingest. The other one is more of incorporating that into products. So there's a tech aspect here where a product could white label that application and bring that technology into their infrastructure or their product portfolio to help, move that technology forward with whatever application they might be using.
Right.
Again, it's vitally important, as you mentioned, Moshe, that the data structure, the formatting, the structured elements are critical here, right? And I think NLP is the product to do that. It
Nice.
still needs some growth, right? Evolution, as any tech does.
Absolutely.
But I think we've narrowed it down to such a high rate of accuracy. And I think what's vital with that is those knowledge bases that we've applied to the application.
That's what I love about products. It's not like a project that has beginning and end. Products never end.
It's an
So
evolution.
there is always evolutions, always places to improve, especially with more data coming in, more improvements in other areas coming in. And sometimes we're in front of those places. Sometimes we have to catch up, but it's always an evolving thing. But this is the question of maybe the $1 million question, maybe more. How do you measure the value?
How do you measure the value of an extra minute on the planet, right? I can't underline the importance of what we do, especially in the oncology space, right?
Yes.
The value at the end of the day, the value is measured for me personally, if is in customer feedback, right? If they can tell me that we leverage your product to increase our efficiency, to speed a treatment to a patient, to reduce overhead in our workflows, making us more efficient, enabling us to see more patients in a day, that's how I measure value. Now we do the marketing stuff, right? We send out surveys, we pay close attention to that kind of feedback, but there's nothing better or more impactful than picking up the phone or going to visit a customer in person and asking that question: are you getting the value for the product? And most of the time they'll be bluntly honest with you, right? And it may not be a answer you want to hear in some cases, but I think if you're doing the right thing and your mind is in the right spot and your heart is in the right spot when you're developing a product, especially in healthcare, you're going to get that feedback. You're going to be able to measure that value and know if you're hitting the mark with your customers. But it's critical that you have those open communication paths and you're listening. Number one, listen to your customer. Absolutely. That's the only advice I would give a new product managers. Please listen to your customer. They know better. They know best. Mm-hmm. So that would be my advice to a new product manager.
Perfect. You mentioned a bit throughout the podcast things that you are working on today to create more value. What's your aspiration for creating additional value with products that you're working on?
Again, my pet project, I think one of the most impactful additions that we're going to be bringing to the Inspirata family of products will be based around the business intelligence capability, the dashboarding. That's at the top of mind for me. I was at a Northwestern commencement a number of years back, and Ginny Romedy from IBM, the former CEO of IBM, gave the commencement speech there. And she said something that has resonated with me ever since. And it was, big data is the world's next natural resource. Now, she said that probably 10 years ago. And look where we're at today. So this is really what's going to drive it home for me, is being able to provide an analytics package for the customers so they can drive both their outcomes, they can see the impact of their outcomes, they can pivot their approach or their workflow if those outcomes give the data that support that approach. I just think by providing those insights into their data, that the customers are empowered to making more impactful decisions. They can provide more efficient, value-based care. And again, I think it ties right into the equitable access to the data, right? How else are they going to know that they're being biased or not equitable in their healthcare delivery mechanisms if they don't look at the data? That's what's going to drive them, right?
Right.
You know, it's difficult, right? You have to think about the users at the end of the day. Are they in a resource limited area? Do they have a financial constraint where they're not able to purchase the latest and greatest tools to, slice and dice the data? Are there regulatory agencies that are impacting or prohibiting certain reimbursement policies? I think those are basic things that need to be addressed and changed to support a broader access to tackle this challenge.
With respect to technology taking in place, it's always this fine line that, where does that lead us with respect to all new things? So, like, for example, with OpenAI, there was when it was launched, and now I see more and more forums that talks about how OpenAI or ChatGPT is making a difference in how patients conceive or receive information or data. Like, for example, I can go into ChatGPT and ask about a specific oncology question, and the ChatGPT would give me an answer. So, and then I'm comparing that with what answers I'm getting from the doctors. So
exactly.
So if ChatGPT or OpenAI becomes a virtual assistant, medical assistant for a lot of people, then it's a very difficult place to be for you. So how do you see that?
Well, I think that's one of the biggest challenges for us right now in healthcare is the adoption of AI. There's such media hype around it right now and the dangers that it might present, but I'm not hearing a lot of the positives about it. What benefits are these applications bringing to the table? From a healthcare perspective, there's a trust issue, right? We know that AI can be biased. We've seen examples, and it's been on the front page of the news and on TV even recently in the past weeks. So I think the trust issue has to be overcome, and that's a proof point over time that will be improved upon. Accuracy of the data that it's pulling from, I think, has to be considered. You have to consider the resource that ChatGPT and OpenAI has at its fingertips, right? It's the internet, basically. And we know that that's not always a great place to start.
My kids always tell my wife when she looks for information about medical situations, don't look at Dr. Google. So now they will start saying, don't look at Dr. ChatGPT. So
I did the same with my mom. I mean, she's 81 and she's out there using ChatGPT or
Yes,
yeah.
ChatGPT,
Like,
81 and using ChatGPT. My God, they should have an episode with her.
It's incredible. Yeah. Well, yeah, I created a monster, I think, but we've recently partnered with Rootquotient to do some of our development work, and it would be really amazing to come back and give feedback on that whole experience. And it's been wonderful up till now. We're early in our process, but I've really enjoyed working with the team, and I hope
we appreciate it. Yeah,
bring good things. Bring good things to our customers and like I said, ultimately the patients at the end of the day. Right?
And that's also what drives us as well. Let me just ask you one question before we wrap up. If you would like to give a shout out to any product out there, it doesn't have to be in oncology or anything. Just a product that you like and tell us why you like it.
So, kind of an obtuse response to that question, but I've recently, data is one of our biggest challenges in this development space. And how do we test what we develop, right, in healthcare? And one of the biggest challenges is getting real world data examples. Customers are I mean, because of HIPAA and privacy rules globally, you're not getting patient data, real patient data, in a meaningful structure to do testing. So that's one of our biggest challenges. I have to say, I talk daily on this subject internally about how do we get the data, how do we mock it up, how do we leverage our clinical resources internally. So there's one product out there that I've run into recently, and it helps me develop HL7 messages and edit and modify those applications or those messages to feed into our system as what you would see normally in a hospital workflow.
It's very interesting because you need data to arrive at important measures and features and functionalities. And
Exactly.
it's a vicious cycle as well. Like, patients are concerned about sharing their data, and then how do we draw the compliance line, the privacy line, and the data, and also the data necessary for us to continue supporting the initiatives from the health tech perspective.
Exactly. The integration, I think in my world, the integration to other healthcare systems is the number one challenge, just from a logistical standpoint, right? How do you integrate to the EMRs? How do you integrate to the imaging systems? How do you get that data that my product needs to work efficiently and properly? And you go into a customer site and they may just say, figure it out. So you have to go and reach out to third-party vendors who 9 times out of 10 want nothing to do with you or feel that you're a competitor and they don't want to give away any kind of IP. But at the end of the day, we're just trying to integrate the healthcare enterprise. IoT, it's a philosophy that's out there, just short of a standard, and I wish they would cross that line and maybe force it. But being able to connect healthcare systems to each other to share information rather than propagating this issue that we have of scheduling or repeating exams and tests and increasing those costs across the board. So it really needs to be addressed. So if I can do one thing in my tenure as a product manager, that's what I want to improve is how do we make getting the data to make good products easier.
And that's a goal or a vision that derives directly from how can we help those clients.
Yeah.
Did you find the name of the product?
I did. That product is called HL7 Soup. So healthcare level 7 is the format or the standard of the messages that we use. Soup. SOUP.
Very interesting.
Yeah, it's very straightforward, very simple to use. I picked it up, downloaded it, started using it within minutes. It's just one of those challenges that we face in developing and providing that interaction between different data sets and different applications. And it was so easy to use. I've already got my developers looking at it too as a possible tool. So shout out to HL7 Soup.
Thank you for that shout out. This is a great shout out. I love it. I love it that it's not a known name that everyone knows about. Thank you so much. Where can people reach out to you if they want to continue the discussion with you?
Email is probably the best. It's tmasters@inspirata.com. That is I'm always on email, so I'm very reactive there. So I'll get right back. And check out Inspirata.com. Check out our website. Look at our products, and I think we have so much potential. We've been in this space for 20 years. That's rather uncommon these days to see a software company have that type of longevity. And I think we have great plans for the future with our Trial Navigator suite. Really looking forward to helping our patients out in that trial matching space.
Amazing.
I really love this conversation. You bring a lot of positivity to this space, especially talking about the subject matter we have spoken the entire time today. It's oncology, and I think it's. I don't think we should take this lightly, but also approaching it with positivity and approaching it in a sense of giving light and making sure that we move towards healing and we move
Yes.
towards patient experiences and increasing the lifespan. There's so much joy to be celebrated there. I think that's fantastic that you brought that aspect to this equation. Thank you so much for joining us today. Looking forward to more collaboration in the future.
Thank you for the opportunity.
Take care, Tim. Take care, Sri. Thank you.